Hi, everyone. This is Dr. Joan Hunter. It's so great to see you again today. It's summer in the Pacific Northwest, and for many of us, that means getting active outside. And it also means maybe relaxing with an adult beverage. So, today in our toxin reduction pillar, I want to talk about alcohol consumption. And in lifestyle medicine, we really have a question about whether or not there's a healthy level of alcohol consumption. Certainly, medicine can tell us that there is a clear unhealthy level of alcohol consumption, and we'll review that. But even within those levels, we really aren't sure if alcohol is a healthy substance. So I want to start by reviewing really what a standard alcoholic drink is and bring some awareness to the volume that you might be consuming when you think you're having a drink. So this is the definition of a standard drink. You can see that it's 12 ounces of a regular beer, and that's about 5% alcohol by volume. Now, in the Pacific Northwest, I don't think they even sell beer that is that low in alcohol by volume. You can see that 8 to 9 ounces of malt liquor, which we don't normally think of as drinking, but if you think of that as 7% alcohol by volume, I mean, most beers in the Pacific Northwest, if you get a strong IPA or something like that, are going to be about 7%. 5 ounces of table wine. So, they make glasses of wine that will actually hold a whole bottle. So you think you're having a small glass of wine, but most of us are definitely getting more than 5 ounces per glass. And then a mixed drink, at least if it's a shot, is going to be probably the most straightforward. So 1.5 ounces of a hard liquor is one shot, and that is considered a standard drink. So again, if you're sitting down in a pub and having a 16-ounce pint of a 7% beer or more, you're actually already having two drinks just with that one pint. So I just want to bring the awareness to that because, especially in the summer, it's hot outside, drinks are going down pretty easy. You can get to 2, 3, 4 drinks before you even realize that, you've consumed more than the recommendation. So here's a way that we think about alcohol consumption in medicine. There is a recommended limit to the amount of alcohol you consume, and it differs between men or women. Now, I used to think this was really unfair, but ladies, we have less alcohol dehydrogenase in our stomachs. So that's the actual enzyme that breaks down alcohol for our bodies to digest it. So we feel the effect of one drink much more than a man does. So the recommendation is really no more than 7 drinks a week for women and no more than 14 drinks a week for men. And also the consideration of how many drinks you consume in any one sitting. So again, I'm referring to standard drinks that we just reviewed. So for women, that's really no more than 3 on any day. And for men, it's no more than 4 on any day. We do know that people who drink at a higher level than that, 4, 5, 6 drinks a week, so that's more of a binge drinking type pattern. And that can lead to some pretty serious health consequences. We also know people who are routinely drinking above this level get into an unhealthy level of alcohol consumption, and it has a lot of health impacts, and we'll review that shortly. But if you drink less than your recommended drinks per day and less than the recommended drinks per week, it's very unlikely that you will develop an alcohol use disorder, so an actual addiction to alcohol. However, these levels might not be strict enough to prevent some common medical diseases that occur with chronic alcohol use. So here are just a few of the health effects that alcohol can have on our body. So we all tend to think about alcoholism and people who have been long-term heavy drinkers getting something called cirrhosis or having alcoholic liver disease. That's really just one downstream effect of alcohol use, and that's from fairly chronic and heavy alcohol use. Now, several other organ systems in the body can be affected by chronic alcohol use as well, and some might surprise you. So that your cancer risk increases with alcohol risk, and we'll talk about this in a different talk, but it's at a relatively low levels. Your immune system actually gets depressed. One night of binge drinking can suppress your immune function for almost 24 hours. We also know very clearly the relationship between alcohol consumption and heart health. So you may be surprised because most people think of alcohol as a heart healthy substance, and those studies really are inaccurate. So been some recent publications by the American Heart Association and also the World Heart Federation, really encouraging people to drink at a low to moderate level. And if you don't drink, please don't start drinking to help your heart. So that's a different messaging than we've had before. So again, I want to just bring awareness today about what a standard drink is, probably less than you're consuming, what the guidelines say about unhealthy levels of drinking, and really have you start to think about, is there a healthy level of alcohol consumption? So of course, this is a personal choice, and we have to kind of weigh the risks and benefits. Um, However, if you don't drink now, please don't start. I think that's a pretty clear health recommendation. And really, less is more when it comes to alcohol, especially for women. And I'll get into the potential risks of alcohol on women's health specifically in a future talk. So thank you for tuning in today. I hope you're enjoying your summer wherever you are, and please do so in a healthy, happy way. This is Dr. Joan Hunter signing off to your good health.